Hi, I'm Dr. Mahnaz Rashti. I am a periodontist and I practice in Beverly Hills, California. Today I want to speak about All-on-4. I hear a lot of patients calling and asking me if they are a good candidate for All-on-4, or they don't even ask for that, they just want to have All-on-4. I really think this is very important for me to bring it to the attention of the general public about All-on-4. I hear a lot of patients, they just call my office and they want to come for a consultation for All-on-4. And when I sit down and talk to them, most of them, they don't have any idea. All they know is that they have gone to a dentist, they got a consultation, they have been told that they are going to go to the office, all of their teeth are going to be extracted, and then they're going to walk out with 2 fixed bridge or 2 fixed dentures in their mouth, and they will be very happy with it. When a patient loses their teeth, what happens is that as a result of not restoration or not placement of the implant, the patient gets severe bone loss. You know, the denture is going to rub on their bones, and also because there is no teeth, there is no root to stimulate the bone creation or production, the patient is going to end up with severe bone loss. So years ago, when implant was not so popular, people would go, they would pull their teeth for many different reasons, periodontal disease or cavities or broken teeth or whatever reason. They would pull their teeth and they had the understanding that, okay, well, I lost my teeth and I have to wear a denture. And that was a major belief for a lot of population, until little by little they would realize that their denture are very loose, they can't even retain it anymore, denture glue doesn't work anymore, and implant was getting more and more popular. And when they were going for a consultation or asking for dental implant, unfortunately they would hear that you cannot have any implant, you are not a good candidate because you have severe bone. So finally, a very smart idea, or the concept of All-on-4, was introduced to the dentistry, and it was only for people with severe jaw resorption or bone resorption, when they had no bone to place any type of implant to secure a denture to it. So for those people, we could place implant in situational position, and then a denture actually would be affixed to those implants. And this idea was more and more popular among the general public and general dentists. A lot of general dentists took some classes over weekend, believe it or not, it's just like a weekend classes. And any patient who would come to their office, they would come up with the idea of All-on-4. If you had like cavities, if you had gum disease, whatever reason was, they would pull all the teeth and place 4 implant, and a denture would be fixed to their jaw. However, you as a patient, do you know what happens to you and what happens to your jaw when they do that? That's very important. There are stuff that you as a patient don't know what happens to you. All you see is like, oh look, I have a fixed bridge or fixed denture is fixed to my implant and I'm very happy. So I want to explain to you, and I want to explain to you on these photos, and then the final decision is yours. So I want to show you on these photos basically. So when you go to a dentist and you have your teeth is broken, remember you're going there because your teeth are broken and you need that's something that can be fixed with multiple crowns or veneers, and the cost is so much higher. They introduce the idea of like All-on-4. They pull your teeth and then you have that much of bone which we can place implant. However, for you to be able to become a candidate for All-on-4, they cut this much of your bone. Remember, you have the bone. They need room to fit the height of your denture, so they cut the entire bone, which is average. They have to remove almost 2 centimeters of your bone. Look, this is how much they have to cut. And remember, this is your nose here and this is your sinus here. So they literally destroyed this bone to be able to place the implant with this position, as opposed to place the implant like this position. So this removal of the bone is 100% permanent. There is no way you can ever replace this bone loss. So what's going to happen is you place the implant, you get the denture, but unfortunately after a few years you're going to start to have infections because there is not good access under the denture. Then you come back to our office as a periodontist and we need to open the area and look at this. The implant is 100% infected. If you look at these, you can see these implants are so infected. Look at this, completely infected, and so we ended up removing this implant. So when we go to the CT scan of this patient, you can see the upper is completely destroyed. And if you look at this view, you can also see this is her nose, these are her sinus, and there is no bone left here. So now, as I mentioned before, the bone loss is permanent. There is no way that we can create bone for her to be able to place any implant, and this damage is permanent and untreatable anymore. Before you make such a big decision of your life, make sure you question, you make sure you're clear that what is that is going to happen to you while you're sedated and they are pulling your teeth and placing the implant. You want to know, and then you make an informed decision that, okay, well, I understand the consequences of it. I know that I'm going to be happy for about 4 to 5 years, but what about after 5 years? Or what's going to happen if this implant fails? Would you ever be able to restore your mouth or restore your lost bone, which is man-made, which is a dentist actually manually cut your bone and toss it in the garbage? Thank you very much for watching this video. If you have any questions or comment, please write it down and send it to me. I'll be more than happy to reach out and answer your questions. Also, if you learn anything from this video, when you go to a dentist, it's exactly like you go to a mechanic. Ask questions, be informed, be educated before you make your final decision.